Hi, everybody. This is Kristy Bird MaKieve. I'm the CEO of Healthy Rural California. I also have another hat, that is being Executive Director of Butte-Glenn Medical Society. These two nonprofits, one is 75 years old this year, that's Butte-Glenn Medical Society, and then Healthy Rural California just celebrated its 1-year anniversary in January. So today I'm really going to talk about one of the efforts that Healthy Rural California has embarked on, and that is our Graduate Medical Education Committee. I am needing to explain what Healthy Rural California is doing because we are seeking a total of about $500,000. We're looking for partners who can contribute $100,000 to $200,000 to reach our goal so that we can reach accreditation for a psychiatry residency consortium. So I'll back up the truck a little bit. Healthy Rural California is a new nonprofit. It's a 501c3. We got IRS approval in January 2020. And in 2020, we also conducted a feasibility study in the community of Chico and Oroville, which is northern Butte County. And we looked to partner with clinical facilities within an hour drive of Chico and Oroville to set up this psychiatry residency and just kind of explore what would be possible. And indeed, the residency program is feasible. We also have a large Medi-Cal population, so it would provide, our area would just provide a robust and complex curriculum for psychiatry residents. So the feasibility study was reported out in July of last year, and then we partnered with Butte County Behavioral Health to apply for an OSPHD WET PEC grant. It's a workforce education and training grant, and were awarded that in September of last year. Unfortunately, the model that funding still follows is sort of based on what would be a traditional medical school extension residency program. And our community, through the feasibility study, really did select a consortium-based, community-led model. And they'll get to the same point of educating residents at our clinical facilities, but we have specifically chosen the consortium model because we think that will be more sustainable, and it will also provide the breadth of experiences across multiple clinical facilities, which is needed for a psychiatry residency and other residency programs as well. If you're familiar at all with the areas north of Sacramento, specifically in Butte and Glenn counties, Tehama County, Yuba Sutter, there aren't many large health systems. We are unique in this little island of not having the giant health systems that can have a GME department and a whole staff. We are also an area that has been hit by many disasters at this point, unfortunately. The Camp Fire of late 2018, the North Complex Fire of 2020, the pandemic has really stretched our hospitals, clinical facilities, FQHCs to be responsive to the pandemic and not move forward or have the capacity to move forward on medical education, which is an essential function for many clinical facilities. It's what physicians like to do, is to teach and train future physicians, but also in a region that is heavily impacted by access of care issues. We desperately need to have residency programs. So I'm very pleased that Healthy Rural California has been chosen to be the engine, if you will, of bringing medical residencies to the area. Despite all of these challenges, we are moving forward. We have a Graduate Medical Education Committee, and we are going through the steps to be ACGME approved to make all of this happen. This summer, we will really dive into the psychiatry residency program development. We are lining up what will be an intensive trauma-informed care curriculum, which we believe is innovative and unique and extremely appropriate for our area. Butte County has had some of the highest ACE scores in the state of California, unfortunately. And so we have a community partnership leadership through North Valley Community Foundation that really wants to see the psychiatry residency program happen. We have a lot of partners, a lot of future faculty, and a lot of interest just across the board from every different clinical facility and hospital that's in the area. So I'm really excited to share that. I also want to say that I'm excited. We have just hired our Director of Finance and Administration. Her name is Gretchen Bender, and she started this week. In addition, Healthy Rural California had even more of a successful launch than stepping into the graduate medical education world. We were the recipient of 3 awards. 2 of them are bringing us over the mark of $2 million in grant funds the first year. One is a federal grant for drug-free communities grant that supports the Chico Community Prevention Coalition. This coalition was formed in the wake of the Camp Fire in late 2019 to address the particular Chico youth needs, which were drastically, unfortunately, changed due to the Camp Fire. In addition, we have an Elevate Youth California grant, which is a state grant for the Butte Youth Now Coalition as well. So the drug-free communities is up to 10 years, 1.25 million in that time period. And then the Elevate Youth California grant is just under $1 million over 3 years. So we have gone from 0 to 1,000 in, well, 1 million actually in a year's time. In addition, we have a grant to establish a regional mental health task force. The rural counties in general have a more, higher mental health issues, and our area north of Sacramento is definitely in that boat. So we are looking at, currently this task force is looking at what are we able to do beyond, I hope that doesn't show up on my recording. Like beyond the psychiatry residency program, what can we do on a system level, education level, workforce development level that can really turn our mental health issues in the region into something more positive? And that task force has identified social determinants of health, addressing ACE scores, high ACE scores in the area, and then also workforce development. So we're going to be looking more closely at those 3 areas this summer, likely focusing on the workforce development because a lot of ACEs aware grants have already been brought into the community. So that was my update on Healthy Rural California. I am seeking funds to help us get the psychiatry residency formed. The timeline is pretty quick. We will start hiring the faculty this summer, and they are paid. So, we need the funds to make sure that they're on track to submit our application for the residency program in as soon as possible, but likely end of this year, early next year, with the plan that we will be able to be approved and participate in Match Day 2023 with residents arriving for fall 2023. And it's a fast timeline given the world of GME, but we're confident. We've done 2 years of exploration. We have a feasibility study. We're working on our business plan. We are taking the steps for the GME committee to be approved as is. And then once psychiatry is propped up and running, a very close second residency program to be explored would be in primary care, whether the community thinks family medicine versus internal medicine or all of the above or something. I hope it's an integrated behavioral health program, but we'll see. We'll see what the community really feels is best and start propping that up. A very big welcome to our DIO, Designated Institution Official, who is leading all of this effort. His name is Dr. Malcolm McDonald. He is a Chico native and has been in medical director leadership positions with Northern Valley Indian Health, supporting tribal health in the same area, and then was in Hawaii for about a decade on the Big Island, and involved in some residency program efforts there that were also trying to address chronic access to care issues. You know, we don't often think about Hawaii as having access to care issues, but those islands do have a lack of physicians. So we are on the go. If you have any suggestions, please email me through LinkedIn. I'm juggling everything with Butte-Glenn Medical Society as well, but now that we have Gretchen on board, I feel more confident that we'll be able to push through the residency programs much more quickly and effectively. It's always good to have more staff person than just me. So, all right, well, you all have a great weekend. Today is Friday, April 23rd, and I just thought video would be easier to communicate to the universe. So hopefully you learned something or have been inspired to help in some way. Let me know. Thanks so much. Bye-bye.